you could definitely see all the sorry.
Hi everyone, I'm Dr. Kaycee Reyes. You can call me Doc Kaycee. I'm a skin doctor, preventive medicine practitioner, and the founder of Luminisce. In this episode of Skin Vesting, let's talk about hair. Lush locks are a great indicator of youthfulness and beauty for both men and women. So it's no surprise that hair loss can make many feel self-conscious, especially in this day and age, with the emergence of social media platforms like YouTube, TikTok, and Reels. For this episode, we invited one of our patients who also happens to be a content creator, Bianca, the beauty nerd herself. Please don't forget to like this video, subscribe to our channel, and hit the notification bell if you want to learn more from me and from Luminisce.
Hi, I'm Bianca. I'm a content creator. I'm on YouTube, Instagram, and TikTok as Bianca the Beauty Nerd, but I also create content for various brands. As you can see, I have pretty thick hair, and it's so thick it's almost become my personality. Everyone from my titas to my favorite hairstylist would always say, your hair is so thick. I'd say I'm pretty much the last person you'd think of when it comes to hair fall. But despite it looking very thick when you'd see me, when you'd comb through the sides of my hair, you could see very obvious bald spots. I have PCOS or polycystic ovarian syndrome, and getting hair fall or thinning hair is just one of the ways it presents itself. Aside from that, I also got pretty sick last December, and since then the hair fall just kept progressing months after that. The hair I'd find in my shower pretty much doubled, and my floor was always covered in hair. The clinic at Luminisce was always so sparkling clean, and I'd always see my hair fall all over the floor whenever I'd go there. It was a bit embarrassing. Half a year after I got sick, my hair fall was still pretty bad, and I was starting to get scared because I loved my hair. To be honest, I was always thinking about how thick and unruly it was, but when I started losing it, I don't know, it was a scary thought. I never actually sought treatment for it until Luminisce asked me about it. Every 2 weeks, I'd go to the clinic to get my own plasma put into my scalp. So that involved extracting blood, which I'm super afraid of, but everyone was so gentle and it was so quick that I barely felt anything. And yeah, it was a pretty painless procedure. And Doc Kaycee would check up on me every time. And you know what? By the 4th session, I could really see improvement, and they could see improvement as well. So super happy. At that point, there was significantly less hair fall of mine on the clinic floor, and the hair that I'd accumulate in the shower also lessened, probably by half or 75%. I also have so much baby hair on the sides, and my hair has grown a lot. You could see the regrowth. I need a touch-up. Honestly, I was pretty skeptical at first if it would even work, but I can now 100% say that it does, and I'm just so happy to not be balding.
It's normal to lose up to about 100 hairs a day as a result of the normal scalp hair cycle. You'll find it on your comb or brush, or in the shower, or in your pillow. On a normal, healthy person's scalp, about 85% of the hair follicles are actively growing, or hair in the anagen phase, and about 15% are resting, or hair in the telogen phase. A hair follicle usually grows anagen hair for 4 years or so, then rests for about 4 months. A new anagen hair begins to grow under the resting telogen hair and pushes it out. There are 3 main phases of the hair cycle. Number 1, anagen, which is the actively growing hair. This consists of most of your hair. Second is catagen, the in-between phase that lasts 2 to 3 weeks when growth stops and the follicle shrinks. This is usually 1 to 3% of hair. Third is telogen, the resting phase that lasts 1 to 4 months and makes up to 10% of the hairs in the normal scalp. For Bianca, she experienced what we call telogen effluvium. It's a common cause of temporary hair loss due to the excessive shedding of resting or telogen hair after some shock to the system. The interruption of active hair growth can be due to certain drugs, toxins, stress, or inflammation. Here are some causes of the temporary hair loss. Childbirth, postpartum hair loss, physiological neonatal hair loss, acute or chronic illness, especially if there's fever, surgical operation, accident, psychological stress, weight loss, unusual diet, or nutritional deficiency like iron deficiency, and certain medication. Also, endocrine disorders like hypothyroidism, hyperthyroidism, and discontinuing the contraceptive pills. Overseas travel resulting in jet lag, skin disease affecting the scalp, plus excessive sun exposure. The treatment for hair loss is very holistic. It takes both lifestyle changes and in-clinic treatments. We prescribe Bianca to do the following day-to-day. We ask her to handle her hair gently, avoid over-vigorous combing, brushing, and any type of scalp massage. Find out and treat any underlying illness such as seborrheic dermatitis or any scalp disorder, or polycystic ovarian syndrome, which is a hormonal problem which she has. Keep a balanced diet with a clean source of protein, fruit, and vegetables. Supplementation and the correction of any abnormality in the thyroid function or the levels of iron, vitamin B12, and folic acid. We also asked her to try to keep stress to a minimum. The psychological effects of hair loss should not be ignored. We also did a few treatments in the clinic. We put her on the Luxuriant laser hair program. This program involves the use of a 1927 nanometer non-ablative Thulium Laser to create microchannels for the growth factor infusion. This remarkably improves hair thickness and density and also helps with hair regrowth. We also did LLT or low-level light therapy. This helps stimulate hair growth in both men and women. This is scientifically proven with the largest randomized controlled trial by far, demonstrating statistically significant hair regrowth by terminal hair count in both males and females. As a final treatment, we also did hair peptide intra-dermal injections using a patented formula of 7 peptides and hyaluronic acid to revitalize the hair and scalp. These peptides can help decrease hair loss and be an effective treatment for hair regrowth. We're really happy that upon doing this treatment, we saw a major improvement in Bianca's hair. I hope you guys learned a little something from this episode of Skin Vesting. Before you go, don't forget to like this video, subscribe to our channel, and hit the notification bell if you want to learn more from me and from Luminisce.